few different innovations. The first is our approach to measuring clinical data within a healthcare IT environment. ExtraHop is agnostic to specific vendors, specific technologies, which means that for the languages that healthcare IT systems speak, things like HL7, legacy telnet protocols, we can bring all those things together, monitor all of them in real time, and pull out clinical data. That's things like patient admissions, discharges, transfers, looking at the way that messages are fulfilled and prescriptions are fulfilled specifically. If a doctor prescribes some kind of schedule of treatment, we can verify that that treatment is actually proceeding according to plan with the right dosages, the right series of administrations over a period of time. So we can pull that out. Anything that is sort of speaking HL7, telnet, web traffic, we can analyze it for clinical data. Certainly addressing the challenge that healthcare IT is pretty unique. It's grown organically over a period of time, and unlike traditional IT architectures that are centrally planned, there's a group of IT architects that design a system, healthcare IT is largely driven by doctors, because if it doesn't work for doctors, it's not going to go into the hospital room. So these things have grown up sort of organically. We're able to bring them together and monitor, measure them all sort of in a unified fashion to bring some level of order, some level of control to a landscape that's pretty wild in terms of technology. So we haven't heard feedback from patients, which in our case is actually a good thing, because our audience is technology professionals, but also doctors themselves. So the feedback from doctors when we implement ExtraHop, when we start managing the healthcare IT environment, is that it doesn't take them as long to log into their virtual desktops and their terminals. Their interactions with electronic medical systems are smoother, which ultimately delivers patient care outcomes, which is good for patients. But primarily the feedback that we're hearing is very, very positive from doctors and the technology professionals that support them.
So we kicked off about a year ago with the office in Singapore, and expanded pretty rapidly into Korea and Australia and New Zealand. And that's primarily the geographies where we feel that healthcare is of a level of sophistication that we require for our type of product to make sense in. It's the first time we're participating in HIMSS in Bangkok, or at least in APAC. We're seeing a lot of demand for this type of product in Southeast Asia. So I would say, fair to say, wherever we see a demand that is growing, we're seeing that in the large Thailand, Indonesia, those markets. That is very likely where we're gonna expand in the future. They're different in the sense that, first of all, it's a very wide area, as you know. The way healthcare works in Singapore is very different from how it works in the Philippines. It's very different from how it works in Australia. So understanding all of those, how it works in those particular markets is our first step, and that's what we've achieved so far. What we've seen in terms of big differences is the vendors, in terms of some of the health records that are being stored, are different in the US than they are here. Also, the adoption of those systems has been very different in some of the markets that we have in Southeast Asia. I would say Singapore and Australia are probably ahead of the curve, and therefore that's where we see the biggest traction for the product.
I think number one, scalability, speeds and feeds, our ability to cover next generation technologies, hyper-converged technologies, and sort of track the direction that IT in general is moving. Even if healthcare IT sometimes is lagging a bit behind other types of information technology, there are also places where that technology leapfrogs. So a good example of that is in imaging technology. We're the only company that is tracking every type of imaging technology used in hospitals to make sure that radiology images are getting where they need to go in a timely fashion. So, by focusing on the technologies that are very specific to healthcare, and given that healthcare is such a large part of our business, not only are we staying ahead, but in most cases we're doing things that no other healthcare IT vendor is doing. Yeah, we're a company that's swinging for the fences. So we're a growth stage company, founded in 2007. We've been growing very rapidly ever since. Asia and the sort of Pacific region is simply the next venue, the next stage of our evolution, and we're looking forward to bringing a lot of value to patient care within the Asia-Pac region.